This is our first team, and they're going to introduce yourselves and the topic for your listening pleasure, listening and viewing pleasure.
All right, so we did a presentation on language barriers. I'm Ryan.
I'm Rachel. Shannon. Sarah.
All right, and to start it off, we have a little Kahoot for you guys.
Just give us a second.
If you guys pull up on your phones, you guys there should be just like a classroom code we can give you guys. You guys can type it in.
Always does that. No,
That's it.
sorry. Maybe she so good. We didn't start. Yeah. I played it. No, I played
So now I'm going with you guys.
like Emily and
What?
You want that big kind of larger screen?
Yeah.
Yeah, we're going to. Is everybody in for You got it right.
Hey, bro. Yay.
All right, so what is a language barrier? A language barrier is anything that gets in the way of clear, effective communication between yourself and your patient. It's the inability to converse in a language that is known by both sender and receiver, and using inappropriate words or languages and how they can create problems and misunderstandings. These are some statistics on communication barriers in healthcare. 1 in 15 people in the US have low English proficiency. 1 in 5 Americans reside in a non-English primary language. More than 3 out of 100 people have a hearing disability, and that means they're deaf. Deaf or have severe trouble hearing. More than 2 out of 100 people have visual disability, which is how they are blind or have trouble seeing even with glasses. Pennsylvania alone has 135 different languages spoken, and communication errors are the root cause of 59% of serious adverse reactions. And we have a video about ineffective communication. Second example. So that's clearly not what we're supposed to do.
So ineffective communication can lead to misdiagnosis from not assessing patients correctly, having to assume how a patient is feeling, patient not feeling taken care of, nurse and patient both being frustrated, and missed opportunities to care for the patient. 2 common barriers are physical and psychological. Physical barriers that affect communication are noise, closed doors, faulty equipment, hearing impaired individuals, aphasia or speech disabilities. Psychological barriers are emotions, distrust, and biases. And you can eliminate these by using your body language. You'll see in a video coming up, it's the correct way that you should assess patients who you can't understand. Speak loud and clear and in short sentences if they have slight hearing. Allow for possible lip reading by looking them in the face and making your lips presentable.
So eliminating language barriers in people that are visually impaired. So you want to make sure you properly announce your presence in the room to prevent startling them and to establish yourself. You want to talk in a calm voice, like don't speak so loudly to try and overcompensate. Present yourself directly in front of them if they have a slight vision impairment, and explain everything thoroughly and make sure that there is no confusion. How to eliminate language barriers in people with aphasia or speech disabilities. So the healthcare worker must be patient, allow them to try and speak, encourage them to take their time, repeat message to ensure accuracy, encourage them to use gestures or point to objects, provide pen and paper if they can write, use pictures with key messages to communicate. Factors causing language barriers, so multi-language, region and accents, different dialects, inadequate vocabulary, so some words, but not all of them. I know me personally, I sometimes can pick up words, but I can't talk back in Spanish. Interpreting difference, medical condition, preventing patient from speaking, and using the family member. So you don't want to do this all the time, but for simple things like what do they want for breakfast, you can use a family member, but you don't want to use anything serious about their treatment with a family member.
Sorry. How to fix language barriers. So in hospitals, you will see usually phones. They have these blue phones in the hospitals that you could, the patient would be on one line and you would be on the other, and they would be able to hear in their language. There's also interpreters that circulate the hospitals. You can use picture boards or whiteboards. So a lot of the time, if they have that aphasia or they're not allowed to, or they can't speak physically, they'll give them whiteboards or tablets or something like that. And then lastly, you could use family members, but you want to try to limit this because there's room for error. And especially in emergency situations, you don't want to rely on a family member. But if worst case scenario, you can. Best tips to keep in mind for effective communication is to always use eye contact, try to use hand gestures or facial expressions, talk slow and clear to your patients, and try to keep it simple because, a lot of people aren't proficient in medical terminology, so try to use simple terms and, stuff they can understand. If the patient does not understand and try the same sentence again, do not change it up because it may confuse them even more. Try to use pictures and spread out information sessions so the patient doesn't feel overwhelmed by the amount that you're giving them. So some different roles in healthcare that could be used to prevent language barriers are the interpreter, so the person who, may be in the room while, you're giving information. There's also dual role staff. So like just an example, the other day I was in the ICU and a patient from Portugal actually went into cardiac arrest and he needed to be intubated. So they were trying to convey to him that he was being intubated, but no one spoke Portuguese on the floor, but they actually had a nurse come down from like an upper floor to like communicate to him that he was going to be intubated because he didn't have any family around either. So there's also bilingual providers. So sometimes you'll find doctors that, may know Spanish or may know French or, some kind of language. There's also ad hoc interpreters. So that would be like a family member or somebody, that hasn't been necessarily trained in conveying those messages, but can, for sure help. And then a translator, someone who can just write text or drug sheets or, translate information. Another video.
So this is how you should be communicating to patients that you can't communicate with necessarily. You can see she used hand gestures and talked slowly.
Eye contact.
And here's a Kahoot from what you learned. Never mind. questions? Good luck, Jacqueline.
Well,
You want us off of this?
I'm not sure. Where's my other group? Okay, do you have to pull up your PowerPoint? Okay, come on. Okay, so while the other group is getting